Welcome to the Grand Nursing Theory presentation on Betty Newman's systems model. In 1942, Betty Newman was born on a farm in Ohio to her father, farmer, and her mother, a self-taught midwife. Newman grew up as a middle child, having one older brother and one younger brother. When her father became sick, Newman took care of him while helping with farm work, which influenced her career path. Her father died at the age of 36. Newman attended a one-room schoolhouse and had her first job as an aircraft instrument technician. In 1947, she received her RN diploma from the People's Hospital School of Nursing in Akron, Ohio. Shortly after earning her nursing diploma, Newman earned her bachelor's in nursing from UCLA. In 1966, Newman earned her master's degree in mental health and public health consultation from UCLA. In 1985, she earned her doctorate in clinical psychology from Pacific Western University. Newman has worked as a hospital staff nurse, head nurse, industrial nurse, and consultant before becoming a nurse instructor. Newman has taught med-surg, critical care, and communicable disease nursing at University of Southern California Medical Center in Los Angeles and other colleges in Ohio and West Virginia. Newman used concepts from theorists and philosophers from other disciplines, combining them with her clinical and teaching knowledge and expertise to develop the Newman systems model. She referred to Chardin and Cornu on wholeness in systems, von Bertalanffy and Laszlo on general systems theory, and Saya on general systems theory, stress theory, and Lazarus on stress and coping. The Newman systems model presents a broad, holistic, and system-based method to nursing that maintains a factor of flexibility. It focuses on the patient system's response to actual or potential environmental stressors and maintains the client's system stability through primary, secondary, and tertiary nursing prevention interventions to reduce stressors. Betty Newman applied stress theory from Hans Saya in the development of Newman systems model. Hans Saya was the founder of the stress theory and is regarded as the father of stress research. His concept of stress impacted scientific and lay communities alike in fields as diverse as endocrinology, complementary medicine, animal breeding, and social psychology. Saya was the first to describe stress as underpinning the nonspecific signs and symptoms of illness. Betty Newman's theory deals with how a person relates to and responds to stress and achieves homeostasis. Betty Newman also applied Lazarus stress coping theory in the development of the Newman systems model. According to Lazarus, two concepts are central to any psychological stress theory: appraisal and coping. Appraisal refers to an individual's evaluation of the significance of what is happening for their well-being, whereas coping refers to an individual's efforts in thought and action to manage specific demands. Newman's theory focuses on the patient's system's response to actual and potential environmental stressors and maintaining stability through primary, secondary, and tertiary nursing interventions to reduce stressors. Other theorists reflected in Newman's work are Chardin and Cornu on wholeness in systems, von Bertalanffy, and Laszlo on general systems theory. Betty Newman's theory is positively related to the theorists she referenced when developing Newman's systems model. These philosophical theories that serve as reference and building blocks to her theory focus on individuals' stress, response to stress, and adaptations. Her system model is described as a continuum between wellness and illness, with adaptation strategies when faced with stress to maintain the positive side of the continuum. Betty Newman developed a nursing theory based on the individual's correlation to stress, reaction, and ongoing reconstitution. This theory model offers a comprehensive and all-inclusive method to nursing that upholds a dynamic of flexibility. This theory provides a holistic approach to viewing any patient. By this means, we are not only treating illness, but also the entire person. Thus, all characteristics of patients contribute a view of how the patient deals with treatment and recovery. In addition, the Newman model offers different kinds of situations to be interpreted in so many ways. Thus, the central philosophy of the theory contains resources that are enclosed by three things: several lines of resistance, which include factors that aid the patient when fighting a stressor; the normal line of defense, which signifies the patient's equilibrium; and finally, the flexible line of defense represents continuing nature that can quickly transform over a short period of time. The theory supposes that nursing is concerned with the whole person. Newman defined nursing as a unique profession concerned with all the variables affecting clients and their environment. That means nurses' insight affects the care given. Consequently, the theory states that the perceptual ground of the caregiver and the client should be assessed. In addition, the theory helps create goal-directed, combined, holistic approaches to the client. The Newman nursing course arrangement consists of 3 steps. These steps are nursing diagnosis, nursing goals, and nursing outcomes. Diagnosis includes obtaining a broad, all-inclusive list, and wellness can be determined based on it. Goals are recognized by using intervention between client and caregiver for anticipated outcomes. Outcomes are proven concerning the goal of the 3 prevention intervention manners. At last, evaluation is used to see if the desired results have been attained or if there is a need to redevelop the goals. The environment is defined as internal and external forces surrounding the client, influencing and being influenced by the client. In this theory, stressors are essential to the concept of environment. It is also labeled as environmental forces that interact with and potentially alter system stability. Newman classifies 3 pertinent environments, which are internal, external, and created. The internal environment is intrapersonal. The external environment is interpersonal or extrapersonal, with issues happening from outside. The created environment is involuntarily developed. The Newman theory is considered a wellness model. It is also viewed as a part of health, which ranges from wellness to illness and is dynamic in nature. Newman states that optimal system stability is the best possible wellness state in any given time. The systems model blends information from several disciplines, and Newman includes philosophical beliefs and clinical nursing knowledge. The main concepts recognized in this theory are the holistic approach, open system, environment, client system, normal line of defense, flexible line of defense, health, stressors, degree of reaction, prevention as intervention, and reconstitution. In addition, Newman defines an adjustment as the progression by which the organism pleases its needs. Also, Newman defines stress as a nonspecific response of the body. Consequently, stress raises the demand for adjustment. Newman adopts different concepts and their relationship with nursing. One of the concepts is primary prevention. This type of prevention is used to protect before meeting a harmful stressor. It also reinforces organism's normal line of defense to lessen the reaction to the stressor. Secondary and tertiary prevention are used after the encounter with the harmful stressor. However, secondary prevention tries to decrease the effect of the stressor using early diagnosis and efficient treatment. Likewise, these concepts are described as the strengthening of the internal line of resistance. At last, tertiary prevention efforts reduce the remaining stressor effects and bring back wellness. As previously discussed, the Newman theory is a holistic wellness model with concepts in health, wellness, illness, stressors and reaction, prevention of stressors, and reconstitution. Here is a list of the concepts related to the client as a system. These concepts describe how energy is processed and the defense mechanisms that help to bring stability to the client system. The Newman systems model has been utilized in clinical practice, nurse education, and nursing administration. Let's use a coronary artery bypass graft patient for an example of the systems model in clinical practice. the nurse must assess the client for potential stressors and develop strategies for primary, secondary, and tertiary stress prevention. Primary prevention can be as simple as patient teaching. Secondary prevention, occurring after the stressor has happened, could be maintaining ventilation and hemodynamic stability. Planning for physical therapy and wellness assessments are an example of tertiary prevention strategies. Using the same thought process as the patient example, one can apply the systems model to the job of nursing administration. The nurse manager must assess the unit and determine stress prevention strategies. These might include creating strategies for staff retention, planning for increased staffing needs, offering critical staffing bonuses for holes in the schedule, or hiring travel nurses to fill staffing gaps. Landers University and Newman University are two examples of nursing schools that advertise the use of Newman's theory in education. According to the Lander University School of Nursing, the Newman system model, as a framework for organizing nursing curriculum, prepares graduates for holistic, client-centered nursing practice in diverse settings. Although the Newman's model is not testable in its entirety, it gives rise to directional hypotheses that are testable in research. In 2020, a randomized controlled trial was performed to determine the effectiveness of the Coping with Depression program, which is based on the Newman systems model. The study comprised of 72 participants ages 18 and older with a diagnosis of mild to moderate depression who started medication for depression on the day of diagnosis and lacked any other mental health disorders. In this randomized controlled quasi-experimental study, all participants in the intervention and control group completed a pre-test, post-test, and 2-month follow-up test. These tests included a demographic questionnaire, the Beck Depression Index, the Rosenberg Self-Esteem Scale, and the Coping Strategies Indicator. Through evaluation of these tests, it was found that the Coping with Depression program lowered levels of depression, increased levels of self-esteem, increased coping strategies, improved problem-solving skills, and levels of seeking social support, and reduced the levels of using avoidance as problem-solving strategies. The Newman systems model was the conceptual framework for the Coping with Depression program. Through secondary prevention, the program sought to strengthen the 5 variables constituting the lines of defense and resistance used to protect the core structure. This study then used the physiological, psychological, sociocultural, developmental, and spiritual variables of the systems model to test effectiveness of the Coping with Depression program. The Newman systems model has many parts that interact and function in multiple ways. Because of the complexity of Newman's model, it is not considered to be parsimonious. In order to facilitate use, Newman and Fawcett developed diagrams to clarify these interactions within the model. The Newman systems model has extended nursing science as a needs and causality-focused framework for middle-range theory development. For example, prevention as intervention is recognized as a middle-range theory evolved from the systems model. In the systems model, primary prevention refers to reduction of environmental stressors identified upon assessment of the client for the prevention of reaction to stressors. According to Newman's model, stress and stress reaction are at the core of the client's system. Through using prevention as intervention, the nurse seeks to achieve client system stability. This concludes the presentation on Betty Newman and the systems model. Thank you.